Hi everyone, my name is Dewey and I'm doing my educational infomercial on depression. Let's get started. So, what is depression? Depression is defined by severe low moods, a sense of despair, and profound sadness. Depression cases are more than what is considered to be a passing blue mood or temporary sadness. The symptoms of this depression can last for 2 weeks in most cases, but they can take longer, such as months or years. Two main types of depression we're going to be focusing on is PTSD and major depression. So, PTSD. Post-traumatic stress disorder is common amongst people that have been through extremely stressful or traumatic events. Most common people that do have PTSD are military vets because they have been through all types of trauma such as war. This disorder, in my opinion, would be the most challenging in the sense that it affects a person's everyday life to an extreme extent. The PTSD symptoms is a sign that is most difficult for others because of the flashbacks. Flashbacks could include reliving a certain traumatic event that was extremely stressful, and they're in a persistent negative emotional state, including anger, fear, guilt, or shame, and it affects people around them. So there are two main therapies and then one minor therapy that could help PTSD patients. PTSD therapy includes cognitive processing therapy, whereby you explain the traumatic event to the therapist and how it affects your life. And then secondary therapy is prolonged exposure, which aims to make sure the affected person faces the stimulus that he or she has been avoiding. The minor one is a microdose of ecstasy, which has been said to improve the outlook of their patients who have PTSD. So there's not many statistics on depression. Really, it's hard to distinguish between depression and just sadness and just a rough day. This is because depression is ignored, blocking people from helping themselves out in this situation. Depression and suicide do go hand in hand. When someone's depression reaches severe levels, it may make them start thinking of taking their lives. Some of these come true, and what is left is regrets from society, thinking they've had done very little to help the deceased. Here are some symptoms of depression. You're more likely to lose or gain a lot of weight just because of your eating habits. They have a very depressed mood. Victims can feel guilty when it comes to a specific experience or have guilt generally for nothing in particular. The pain of criticism proliferates. In most cases, they lead to hopelessness, thoughts of death and suicide, and self-destructive behavior. Here's some PTSD symptoms. They do some coincide with some depressions, but most noteworthy is a lot of flashbacks. I was in the Navy, and coming out of the Navy, I would have very hard time sleeping, and then when I do sleep, I would sleep for too long and still feel very tired afterwards. So here are the causes of depression. Depression is mainly caused by either genetics, poor nutrition, physical issue, a drug habit maybe, or stress, or a culmination of all of them. If you think you have depression, or if you are suffering from depression, please reach out to somebody. I have sourced two sources, one local and one global. One is the Anxiety and Depression Center in Newport Beach, located at 1500 Quayle Street. And then the other one is the Suicide Prevention Hotline at 1-800-273-8255. If you feel, apologize. If you feel like you need help or someone to talk to, or you're not in your right mind, please reach out to them and talk, because every life is worth saving. Thank you.